The Shipley McAfee Assessment of Fluency. The Shipley McAfee Assessment of Stuttering and Cluttering is a non-standardized criterion reference test that evaluates a client for fluent speech. Fluent speech flows in a rhythmic, smooth, and effortless manner. Disfluencies are disruptions of fluent speech. This assessment aims to discern whether a presenting problem is a true disorder or an instance of typical disfluency. In order to assess a client's fluency, this test analyzes criterion reference factors such as disfluency indexes, associated motor behaviors, rate of speech, associated feelings and attitudes, associated physiological factors, the S-scale, and the parental speech chart. An assessment should be administered in a way that allows the clinician to adapt in order to gain as much relevant clinical information as possible. It should use a variety of assessment modalities and should include a combination of interviewing, case history information, formal and informal evaluations, and client observations. An assessment should be valid and accurately evaluate the intended skills. It should be reliable and accurately reflect the client's communicative abilities and disabilities, and be tailored to the individual client. It should be appropriate for the client's age, gender, skill levels, and ethnicity. A traditional fluency assessment involves the history of the client. This includes a written case history, informal interview, questionnaires, and information from other professionals. Factors affecting case history include medical and neurological factors, family history, sex, motivation, and levels of concern. Stuttering and cluttering are assessed. This includes screening, speech sampling, and stimulability. Disfluency indexes, associated motor behaviors, other physiological factors, rate of speech, feelings, attitudes, and reactions to speech are also analyzed. An oral facial examination, speech and language assessment, and a hearing assessment are also given. The diagnosis is then determined. Factors affecting assessment include type of disorder, setting, client's history, and involvement of caregiver. Maya is a 7-year-old girl who was referred to a speech-language pathologist by her mother and teacher, who both expressed concerns about her stuttering. Maya was the result of an unremarkable pregnancy and birth history. She lives with her mother and maternal grandmother. She has no siblings. Both English and Russian are spoken at home. Maya's mother reported that she first noticed Maya's stutter approximately 6 months ago after picking her up from school one day. Maya's mother had a history of developmental stutter that disappeared at age 5. Since Maya is now 7 years old, her mother is concerned that the stutter could be permanent. Maya's teacher reported that her stutter is most noticeable when she has to answer unexpected questions. Maya frequently exhibits part and whole word repetitions and prolongations. The parental speech chart is a chart that a parent can use in order to track their child's disfluencies and the circumstances under which each one took place. It allows the parent to keep track of the child's speech and notate any questions or concern to later address with the clinician. The parental speech chart looks at the date and time of the disfluency, the type of difficulty, if there was tension or struggle present, the child's reaction to the disfluency, their awareness of the difficulty, the topic of conversation, the child's communicative partner and their reaction to the disfluency, and if the parent noticed anything that preceded the disfluency.
So Anna, thank you so much for taking the time to come in. What brought you in here specifically today?
Well, actually, my mom and I have noticed that my daughter Maya has been having difficulty speaking. She kind of repeats the beginning of her words, and she sort of hangs on to the first letter in words. And actually, her teacher suggested that we come see a speech therapist to just kind of see what's going on with her speech and try and maybe fix it.
So how do you feel that your daughter's speech is affecting her daily life, kind of at home, playing with friends, in school?
Well, her teacher mentioned that Maya seems to be having problems answering questions when she's randomly called on. And she has problems getting her words out when she's nervous, or when she gets really excited about something, she has difficulty then. And I noticed that since she's not able to get her words out, I think it's making her very frustrated, because she can't say what she really wants to say.
Of course.
Yeah. I actually have a question for you. I had a stutter when I was little, but I grew out of it, and I just wanted to know if there's a possibility that I caused this issue on my daughter.
Well, don't put this blame on yourself. There's actually no known cause of stuttering, despite ongoing research in the subject. It's something that people can be born with or they can acquire later in life out of nowhere. You're actually taking a great step today in bringing her in almost immediately after you notice the problem, because it's giving us the opportunity to give Maya the help she needs immediately. We can start helping her as soon as possible now.
Good, that makes me feel a lot better. I also wanted to know, now that I'm bringing Maya here, what is speech therapy going to do for her? Is it going to cure her stutter?
Well, there isn't currently a cure for stuttering. It's something most people manage and can learn how to control through speech therapy. They can learn how to manage the repetitions and make their speech more fluent in general. There is still a chance she could grow out of it because it is a recently acquired and of her age, but you absolutely made the right call in bringing her in as soon as you noticed that there was an issue.
Okay, great. Thank you.
No problem.
The assessment of associated motor behaviors is designed to help identify extraneous movements, which are visible displays of tension, usually involving parts of the orofacial mechanism. It is listed as Form 10-4 in the Shipley McAfee's Assessment of Stuttering and Cluttering. The form lists the most common behaviors, but it is not an exhaustive list of all the possible behaviors the client may exhibit. The clinician fills at the top of the form with the date and client's name and age. The form is divided into sections of various parts of the body, ranging from the eyes to the legs. Each section has a list of associated behaviors that could be present. For example, blinking, shutting, upward movement, etc. are listed under the section titled Eyes. The sections are conveniently listed in order from the most superior body part to the most inferior body part, from eyes to legs. The clinician simply checks off the exhibited behaviors on the left side of the form. Appropriate space is available for the clinician to add any additional explanations and descriptions of the behaviors. Associated motor behaviors may cause tension and discomfort for the client, therefore it is crucial for the clinician to identify these behaviors.
So Maya, can you tell me about what you did this weekend?
I went to the aquarium with my mom and grandma.
Wow, what did you see there?
We saw lots of fish and even sea turtles.
What was your favorite thing that you saw at the aquarium?
My favorite thing was the fish that looked like Nemo. It was orange and white all over. And my grandma she was scared of the sharks. It was funny.
Wow, it sounds like you had a lot of fun.
Yes, I did. And my mom, she said we could go again next weekend.
So Maya, your mom told me that you really like sea animals. I was wondering if you could read me this story about an octopus.
Okay. What do 3 hearts, 8 arms, and 1 huge brain add up to? An octopus, a creature that can do amazing things. Octopuses are extremely intelligent. They can learn new things just like humans. That they've even learned a few tricks to get them out of sticky situations. If an octopus is threatened by a predator, such as a shark or bird, it can use some pretty incredible skills to get away. Octopuses don't have teeth or sharp claws to defend themselves. Instead, they use more clever ways to fool their attackers. Octopuses like to hide themselves in the sand on the bottom of the ocean floor. How, you ask? Well, the octopus is like a chameleon because it can change the color of its skin to match the sand, and this color change or camouflage happens in less than a minute. Some octopuses like to stay in more shallow water where there are rocks and coral. Because octopuses are invertebrates, meaning they don't have backbones. They can squeeze themselves into small spaces between the rocks to get out of reach of their predators. Another way an octopus can hide is by shooting ink. An octopus uses a part of its body called a siphon, I don't know that word, to shoot ink into the water. The ink forms a cloud that hides the octopus. By the time the ink clears and the predator can see again, the octopus has swum away or hidden. It's very much like a magician doing a vanishing act.
The fluency charting grid is used to count the total number of disfluent and fluent productions and to code for each disfluency type. Each square in the grid represents a word of the client's utterance, and the clinician must appropriately notate the type of disfluency present if the client's speech was not fluent. It is a method used to identify and quantify disfluencies. Within each box of the fluency charting grid, the clinician writes the appropriate symbol in the box for each word uttered by the client, either using the predetermined list of suggested symbols for the major categories of disfluencies or by the clinician's made-up key. Each box in the fluency charting grid represents a word, and each symbol within it represents the type of disfluency or indicates that the word has no disfluency present. This helps the clinician identify the type of disfluency that is present. The major categories of disfluency are no disfluency, repetition, prolongation, interjection, silent pause, broken word, incomplete phrase, and revision. After the clinician completes the fluency charting grid, they must transfer the findings into the appropriate areas on the Calculating the Disfluency Index form. By using this form, the clinician is able to determine the total disfluency index and the disfluency index for each specific disfluency type that the clinician chooses. On the form, the clinician must fill out the environment that the speech sample was taken in, along with the sample type and the number of words that were included in the sample. In order to calculate the disfluency index, the clinician counts the total number of words that were present in the speech sample, then divides it by the total number of disfluencies found in the client's speech. After changing this number into a percent, the clinician is given the total disfluency index.